Can a knee or really any other lower extremity injury that occurred during military service cause osteopenia or osteoporosis, maybe of the hip or the spine, years later? I share my thoughts as an orthopedic surgeon in this video. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. This video is the latest in a series of videos I'm making in which I answer service connection questions that I get from military veterans across this country. This one is one that I've thought about a lot with patients over the years, but never really with disability claims until just recently. Can a knee injury cause hip or back osteopenia or osteoporosis? It's a really interesting question. And so a knee injury can lead to a lot of secondary conditions. Osteoarthritis is the one you typically see, but yes, it can lead to osteopenia and osteoporosis, low bone density, typically in the hip, typically in the back. And it's through a number of different forces, through altered biomechanics, sure, but also chronic pain and reduced physical activity. That osteopenia, again, reduced bone mineral density, progresses to osteoporosis. That's where the bones get fragile, can even break. But for the purposes of this discussion, when we're talking about disability claims and secondary service connection, what you have to prove is that the knee injury basically proximately caused or aggravated those bone conditions. And that's where scientific studies become important. The link begins with the knee injury and its impact on gait and mobility. The argument would be the knee condition, arthritis, ACL tear, instability, whatever it is, causes pain, swelling, limited range of motion in that joint. That results in an antalgic gait or a limp in which the veteran favors the injured knee, trying to basically minimize discomfort, minimize pain. Over time, that altered gait shifts weight unevenly, places more stress on the opposite hip, on the pelvis, on the spine. And numerous studies have shown that those compensatory changes accelerate degenerative processes in the hip and the back, leading to the arthritis and a lot of different things that I've talked about on this channel. But as it pertains to osteopenia and osteoporosis, that chronic knee pain very often leads to decreased physical activity, decreased weight-bearing exercise, which are needed to maintain bone health. Bones need mechanical load to stimulate the osteoblasts, the cells that form bone, prevent resorption from the osteoclast that resorbs bone. And so you need that weight-bearing activity to maintain bone health. So you get a knee injury, you get a more sedentary lifestyle, or even immobilization, which happens sometimes after an acute injury, less stress on the weight-bearing, the knees, the hips, the spine. You get disuse osteopenia, disuse osteoporosis, a decrease in bone density due to that unloading, and numerous studies have demonstrated that. Again, it's not something you typically see in disability claims as much as you just see it in orthopedic surgery practices. If it's a female veteran, that risk is even greater because of post-menopausal hormonal changes that already predispose to osteoporosis. You compound that with a knee injury leads to disuse, the antalgic gait, yes, can lead to osteoporosis. For the purposes of the VA claim, the disability claim, the secondary service connection, basically you would want supportive information. Yes, a Nexus letter from a physician citing those studies showing how this could potentially happen, imaging with DEXA scans revealing the osteopenia or osteoporosis and where it is, would all be very, very helpful. But VA precedent has said that this can be a secondary condition, secondary musculoskeletal issues, and that knee injuries can cause back problems, cause hip problems, including decreased bone density, osteopenia, and osteoporosis. But that would be basically how you go about submitting that claim. In summary, the knee can play an important role in promoting disuse and also increased strain. That is a good way to get to causal pathways for a secondary hip and back osteopenia or osteoporosis. I've written an entire ebook on the disability claims process and specifically common reasons the VA denies service connection. You can get that absolutely free. There's a link to it in the description below this video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video and when I start my Veteran Nexus Veteran Nexus Letter Live shows. They're once a month. They're tons of fun. You can ask any questions you have, and I answer them live. Also, if you're ready to work with me, or at least interested in finding out more about working with me for a Nexus letter for your injury or condition, click that link in the description below, scroll past, or get the ebook, but scroll past that. You'll learn more about working with me and working with my team. We try to make the process simple. We try to make it quick, and I try really hard to write a Nexus letter that gives you the best chance of success in your claim. Thanks for watching, and I look forward to helping you.